Hello, মই আপনাৰ লগত আতু জামেৰ মহলা টক শো আনফিল্টাৰতে আপনাৰ সবকে স্বাগত কৰি আছে কোভিড-19 পেণ্ডামিক পৰা দুনিয়া পুৰা লগতে মই খান লগা ষ্টেট নাগালেণ্ড কেবি দিকতাৰি বিষয় আনি দিছে ফাৰ্ষ্ট ৱেভ টাইম পৰা কেसेस কান বেছি উঠি থাকিয়া দো এতিয়া সেকেন্ড ৱেভ লগা লৰাই ক্ৰিয়া সময় দেবি কেसेस কান কমতি যাই থাকিনা আৰু বি উঠি যা থাকিয়া দেখি পাই থাকে এটো সময় বেছি মানুহ ৰখি থাকিয়া নিচিনা ভ্যাকচিনস কান বানাই লোৱা দো ৰিলিফ বি আনিছে কিন্তু মানুহ খান বেছি জাপ লোৱা খান লগা ওপৰ doubts thagina facela lobole na paya bishi ase edu nimide aji moi khan vaccine laga opor jankari kunuba lobole aru doubts kan clear koribole koshish koribo mohan aji tu vaccine laga khota ko bole ami khan log ekta special guest aina ase ami khan log de Dr. Sedevi aina ase Dr. Sedevi do tai CIHSR laga director ase so thank you so much sir for joining us today तो मोहन अजिला का कन्वर्सेशन दो आगे पाएगा मुझे तो क्वेश्चन होती बोले मन जाओ सर मोहन इन्हीं साइड सेक्शन बोले दिस टाइम दो इन्हीं सेकेंड वेव थी मोहन वेरिएंट अलग था के भी विषय जानी पाइशे तो इन्हीं इधर फर्स्ट था क्या लगा वेरिएंट का ना और सेकेंड इधर आई हैव वेरिएंट का ना डिफरेंसेस तो किन्हीं आसे
अच्छा yeah thanks for having me on this talk show actually virus तो ना वायरस तो म्यूटेट कर तो ना चेंज ता लगा फॉर्म चेंज कर तो नॉर्मल आसे ना सब वायरस तो चेंज करिबले आसे होदाय चेंज करि थाके आरो केতিয়াबार म्यूटेशन मीन्स केতিয়াबार रिप्रोडक्शन करा टाइम दे एतो टाइम ते तो मीन्स मिलियंस पर रिप्रोड्यूस करे तो ना तो एतो टाइम ते ताला फॉर्म तो अलप चेंज करिब पारे एटू तो केতিয়াबा तो मेजर चेंज होबो पारे केতিয়াबा माइनर चेंज ना तो वेरिएंट तो होबले आसे ना दैट्स अ नॉर्मल ना नॉर्मल नेचर ऑफ एनी वायरस ना तो वाले भी और केতিয়াबा तो सपोजिंग दवाई ना होले तो केबा एनवायरनमेंट ते केबा मानु कोनबा मानु लगा रेस ते ना अलग रेस ते एटू होस्ट लगते एंगेज करे किने चेंज करिब पारे तो वेरिएंट्स तो बेसी आसे ओले भी मेन वेरिएंट्स एटा तो अल्फा बीटा डेल्टा एप्सिलॉन इनेका आसे तो ना तो कोट परा ओलाय से यूके होले तो यूके वेरिएंट अल्फा को किने नंबर बेसी ताइसे दो करने सिंपल करिब करने इनेका करे देशे ब्राजिल परा साउथ अफ्रीका कैलिफोर्निया न तो एटा तो मेन वेरिएंट बेसी फेमस हुआ तो डेल्टा वेरिएंट इतो तो इंडिया पर स्टार्ट करेছে ना सो दोस आर द मेन वेरिएंट्स तो इतो खाना से
सर सो नागालैंड में तो मोस्ट पॉपुलर वेरिएंट तो कोन वाला থাকে
मेनली डेल्टा वेरिएंट इतिया देखि আছে হলে भी जीनोम सीक्वेंसिंग কই দো ना तो একটা ভাইরাস ওলাই কিনে তাই লাগা আরএনএ কি আছে এটো ছোট জিন তো না এটো मीन्स इतो डिटेक्ट करे बोले मोखान लगा जगह ते तो इनका फैसिलिटी नहीं से दिल्ली नहले पुणे ते पठाई दो ना तो इतो पर इतिया देखिया तो न्यू वेरिएंट कान तो मेनली डेल्टा আছে
अच्छा सर तो इनी लास्ट टाइम इनी फर्स्ट वेव टाइम दे थाके लगा सिम्पटम्स कान थाके आरो इनी दिस टाइम दे इनी एडिशनल सिम्पटम्स कान दो की थाके
सिम्पटम्स तो ऑलमोस्ट सेम আছে হলে भी दिस टाइम तो बेसी सिवियर আছে सो दुईटा मेन আছে इट्स more transmissible or more virulent na more transmissible means moi apni la usorte ja do na means the speed at which transmission kora do eto to beshi high ase delta aro severity bhi this time la to first time para beshi ase
acha to ini aro mon ini itu larai curly vaccine kan aina se to India de bhi popularly used kara vaccine duita to ki ase
इतिया वैक्सीन इंडिया ते हा तो मोस्ट पीपल तो जाने ना ये तो कोविशील्ड ये तो एस्ट्राजेनेका यूके ऑक्सफोर्ड पर बना लगा ये तो यूके ते की बना ये तो और इंडिया ते बना तो एग्जैक्टली सेम आसे नो डिफरेंस ना सेकंड तो कोवैक्सीन तो भारत बायोटेक करा दो और थर्डली तो स्पुटनिक ला तो आही आसे रशियन लगा और इतना कथा কৈ আছে तो यानसन ला भी आही बोले ना तो वैक्सीन तो अलग आसे मीन्स अमेरिका ते थाकिया तो mRNA वैक्सीन কয় ना इतो तो बेसी एडवांस वैक्सीन আছে আৰু Covishield vaccine to adenovirus vector borne vaccine na vector facilitated vaccine means ekta virus neutral virus te etu coronavirus lagai to tala cover te ekta spike protein koi de etu tala upor te lagai kine etu inject kore na
acha
to etu to Covishield to ase moi ne simple paise hole be actually is very sophisticated na co-vaccine Bharat Biotech lagoto ene virus to etu murai die na inactivate kore etu laga ase aru Sputnik vaccine bi similar ase Covishield logote
okay
Janssen la to ola balak ase etu to khali one dose laga na
acha so it's more effective
not more effective it's different na
okay it's just it just works different amni mohan gini vaccine how does a vaccine work idu any olop koi dio parwa
yeah so vaccine to it's a very old science na
yes
bishi sal par hoye ase to na so vaccine to supposing ekta germ na say TB germ or any bacteria na germ aigine mola under te jaile to mola body te affect koribo aro body to ekta response koribo etu to germ ke murabo na hole kom tala effect komti koribo pare na hole to mohe muribo pare na germ to moi ke overcome kore kine to vaccine to ki kore kole to usually any germ aile body to respond to koribo respond to korea to it may be effective or may not be effective hole bi vaccine dia to germ nishna ase hole bi germ to pathogenic ase means harm koribo pare vaccine to harm na koribo hole bi germ nishna ase na so supposing moi apuni ke dikhe ase kole to you are the whole body na
yes sir
hole bi khali moi apni la sukhu na khali saise kole to it's just part of your body maybe moi apni ke recognize koribo pare apni la sukhu para na okay so but the vaccine will not harm the body but it will stimulate the immune response na our immune response to mainly two type ase antibody humoral response koe etu to antibody second is cellular response like T cells koi do na to so vaccine to aile to etu ke stimulate kore na aru alag vaccine ula to different ways of stimulating the body na body response kore to mRNA vaccine to bishi advance ase na etu to jai kine means etu antibody ke stimulate kore to it tries to stimulate it as fast as possible through a very novel technique it's very sophisticated to explain koribole digdar ase
so duni mon ini adikali ni mon ini vaccine kan lui thaka nule dan administer kuri thake dam de side effects olabi I mean pabi manuan bishi complain create ini manuan ge educate kule kan ini what are the most common side effects
so side effects to one is see most vaccinations na pregnancy la no hoile to pregnancy de dia la no hoile to most vaccines to bacha time de de na say chicken pox vaccines polio vaccine diphtheria tetanus sob bhi bacha time de de measles kan na ob bacha time de vaccine dia time de side effect iman beshi na thake now so most vaccines adult age te dia time te to side effect beshi thake to mokan etia covid vaccine dia to mostly adults te dia se to so eto karne moi supposing DPT vaccine bacha time te lagile to I won't have much side effect but eto adult time te dile to side effect beshi hobo so that's the reason why side effects beshi thakya nishna ase na so supposing head to toe na supposing matha headache na fever running nose bit of cough body aches joint pains na that's the most common side effects bacha de hoile to iman beshi na hobo adults hoile to kunba manu to beshi hobo kunba manu to very mild or usually 1 to 2 days e thake most of the side effects na kunba manu to rash bi olai aru kunba manu kwado na moike kwado moi kitabe measles thakya nai hole bi etu dalia pichite measles ase na actually measles নহয় কি rash আছে viral rash না or a reaction to a vaccine but most of the times it to any jai no so vaccines very serious side effects to bishi komti ase aro all vaccines will have side effects na polio hoile bi dpt hoile bi tetanus hole ekta vaccine bi nai side effect na thakya na to covid vaccine bi vaccine ase side effect to thakiboi thakibo na hole bi vaccine to ajikali to say for example na 100 manu ke vaccine dekene ekjon side effect hoile to 1 in 100 to bishi komti ase eneka kobo na so it's okay no problem eneka kobo do hoile bi 1000 manu ke dekene 1% side effect hoile to 10 hoise do na itu bi iman beshi nishna na hole 10000 te hoile to 100 hoi jabo 1 lakh te hoile to 1000 10 lakhs hoile to 10000 to 10000 to bishi manu side effect hoa nishna ase na so actually the problem is not side effect bishi inika no hoy khali numbers bishi 1 million manu te dile to at least 1 lakh nishna hoi jaise to percentage so it's just a number play na to etu kadi vaccine bishi thakya nishna ase hole bi নহলে তো it's the same as any other vaccine
acha so sir ni eta tak ni sai shukle vaccine ra idu covid laga vaccine marigina sabse severe any side effects to ki ase any ko report na
any vaccine na any vaccine the most severe side effects to kumba mado do say supposing demyelination koi de na demyelination means nerve kan itu inflammation hoy kine na to etu khan to any vaccine can cause that na to so stroke nishna not exactly stroke but paralyzed hoy jay no hoile to unconscious hoy jay ine kana any vaccine so covid vaccine bi ine ka ase to that's the very severe type of thing no kunba manu ko to stroke na clot hoy kine paralyzed hoy jay na ine ka bi koi hole bi etu to proof koribole bishi digdar ase because supposing apuni aji vaccine de loise na aro apni la age 70 years ase aro apni aji vaccine koriche kali stroke hoise to vaccine karne stroke hoise inika kobo na pare because anyway normal population te bi stroke to anyway hoi jay to definitely vaccine karne stroke hoise etu kobole digdar ase most likely apni vaccine loise aro evening te garlic khaise garlic karne stroke hoise hole bi vaccine karne kobo na okay I'm not saying garlic causes stroke I'm just giving an example na so yeah there are certain side effects like mRNA vaccine te to myocarditis na heart olop inflame hoa to olop report kori ase hole bi 1:1 correlationship nai na
okay sir so manini khobor honia la hisab te Dimapur de ekta manu idu vaccination lugina paralyzed hui jaise kuna allege kuna ase to any chances to ki ase ninga paralyzed hui jawle
to idu to proof korobole bishi digdar ase vaccine karne paralyzed hoise eneka kobole bishi digdar ase na so supposing tai paralyzed bi alag type ase na so supposing stroke hoile to paralyzed hoi jabo na most of the common stroke to bleed no hole ekta khun la rasta block hoile to stroke hoi jay na to etu ekta side paralyzed hoi jay na so it may be because of vaccine it may not be because of vaccine na
but there's possibility
it's very difficult to prove na because any bi stroke to manu hoi jay to na bp thakya kan to any bi stroke hoi jay so tai vaccine loise etu karne stroke hoise etu kobole digdar proof korobole bishi digdar hobo na moi rasta de jai thakibo my heart attack hoi jabo na heart attack hoi kini moi giri kine gari run koribo na over mala so gari karne se kobo but actual to heart attack karne thaise faint hoa karte gari la rasta de girise na so cause and effect proof korobole bishi digdar ase na but majority to millions vaccine korise or bishi manu to majority have never had a stroke na so it's very difficult to prove but that should not be the excuse not to take a vaccine.
Okay. Sir, ini mohan COVID pra infect hoise na kule kiman deri rukya bichide aru vaccine do lobo lage.
So eto to government la regulation aru guidelines para the 3 months pichete koi ase na.
Okay.
The exact duration is not 100% clear na, because COVID to new disease ase eto karne sob manu eta bi trial kori ase na. So it may be 2 months, it may be 3 months, it may be 4 months. Eto to exactly clear kore nahi, but currently they have said 3 months.
Okay.
Na, so that may change na.
So me janiulim kile do rukyuri lagi jai inya infect ho bichide do vaccine lobole.
Yeah, so the thing is this is a complex topic na. So especially between 2 doses hoile bi na.
Acha.
First actually vaccine diya to after the infection vaccine diya to it's like a booster dose nishna se de na. Because normally supposing moi measles bacha time te measles thakishe kole to I don't need to take the vaccine again na, but this is a new disease eto karne vaccine to we are not sure whether the natural infection will cause lasting immunity or not na.
Achha.
Most likely it will, but eto vaccine diya to booster nishna ase na. So this exact duration of 1 to 3 months is not very clear. Right now they're saying 3 months.
Okay.
No? It's like a booster. No? So 3 months. Why 3 months? That will be difficult for me to explain. No? Because that they will look at the antibody kinetics. They look at several factors. No?
To ini aru mohan ini COVID lagi bichide antibodies ka mohon laga body di thage na ko koi dui kiman deri nishna thage antibodies to.
To itia tak to kun bi to proof kurobo na pare na. Firstly, one is antibody te olop manu bishi confusion ase na. So mokan measure korea do daily te seroprevalence study nika purisha hola na, aru all India te seroprevalence around 60-70% nika hoise koise na. To key measurement korea se kole to takan antibody, but these are not neutralizing antibodies. Neutralizing antibodies the research lab te try kore. To supposing virus grow korishe aru antibody iman dalishe itu to virus la uporte lagai kine virus ke morai deshe, to itu la antibody to taken measure kore to neutralizing antibody koi na.
Acha.
Ole bi mokan any seroprevalence study kore to itu antibody to thakiboli bi pare na thakiboli bi pare na.
Acha.
So supposing apni ke vaccine korishe to 2 doses loi leshe, to antibody measure korele to ketiabar to high bi hobo pare, ketiabar bishi low bi hobo pare. Itu to it doesn't correlate with in protection.
Acha.
Hey, na. So measuring antibody is no use. It's not advisable. It's only for research studies na. Apni la question to exactly ki thasle?
Yes sir. Ini
yeah, how long the antibody lasts? Nobody knows currently. Now, no antibody will last forever. No, any vaccine delivery or any infection. So supposing, say, let me explain by hepatitis B.
Okay.
Hepatitis B, they 2 types of antibodies, IgM antibodies, IgG antibodies. This is commonly with any infection. Na? IgM to beginning te uthibo ineka. Uthikine ineka plateau thakibo aru slowly niche jabo. Na? IgG to olop pichete start koribo and last for a longer period. But will be over a span of time. Sob antibody to komti hoi jabo. Na ekta antibody bi hodai update na thakibo. Na? So generally mokan hepatitis B to booster dose 3 doses ase aru 3 doses to sufficient nishna ase. Booster dose iman na lage. Recommendation to health workers kan ke diye na. Say every 5 years. Wale mokan to kite bhi na diye. Nishor ke bhi na. We are not interested na, because we feel that vaccine laga piche te do memory cells na, body la immune memory cells to jani she kole to takan anytime COVID lagile to it'll just stimulate the memory cells and it'll produce antibodies.
Okay.
So it's not necessary that the antibody has to be completely at a high level.
Okay.
So currently kiman deri antibody thakibo, it's not, that does not correlate with protection.
Okay.
So maybe we'll need booster dose every year, but itia kobole digdar ase.
Acha. So to ini mohani vaccine nuli bi kunwa han gi do vaccine na dile bhal inega thage bimari thage kando iniga higi bimari thage kando vaccine do na loile bhal ase.
Now itia to mainly ito contraindication koi de. Contraindication means taike na dibo lage. Now there are very few contraindications now, no? Will be especially live vaccine. So or inactivated vaccines ito to na dilim balase, like to Covaxin vaccine na is a inactivated vaccine na. So it would be preferable not to use that for people who are very immunocompromised na.
Acha.
So supposing HIV patient ase or say kidney transplant hoy kini steroids beshi lo ase ito kanto na better use the other vaccines.
Acha,
na.
to vaccine na
But
ni alak
actually yeah, different vaccines. So it's not that you should not give, is that dile bhi iman response nahi bo na. So say apni bishi deri diabetes thake kole to apni lauporte the vaccine may not be as effective. No, so kidney failure ase, liver disease ase, autoimmune disease ase, steroids lo ase kole to it may not be as effective, no. But very few contraindications now. Ita to any pregnancy te bhi aro breastfeeding mother khan ki bhi ita to they're saying it's okay to give, no.
Okay. So to ini monini vaccine lo bichide kurule na kurule hambi kinya with kiba hambi thagiu do precautionary measures khan bole ki ana se vaccine lo bichide is there anything as such?
So generally we can go back to normal work na. But say supposing especially mRNA vaccine de kunba manu to myocarditis na, heart inflammation ola bolaise do na.
Acha.
For some people there have been some reports, so ito karne takan ke kwado because myocarditis wale to heartbeat bishi fast hoy jay na, to ito karne bishi exercise na koribi immediately na. Now only to you just stay at home, there's no problem, no.
Okay, so there's no such thing.
Yeah, but then the thing is so if you fever hoy she kole to better not to do exercise na. You just relax at home na.
To ni aro vaccine
Usually it's this. So according to government regulations, half an hour to observe kore.
Okay.
Supposing any allergic reaction. So allergic reaction, it can happen to any injection, not just vaccines.
Okay.
So they just observe for half an hour. It's a healthy thing to do.
Okay.
It's sensible to just observe for half an hour and sub center to be in a practice korea se to.
So to ni mo agide apni gi hoti thage nishna ro do vaccine hando kiman effective ase ita aro tana duration do kinya thage kiman deri effective thage vaccine do maile.
Yeah, so most of the vaccines so around 90-95% ase na.
Okay.
Messenger RNA, mRNA vaccines come to around 90-95%. Our Indian vaccine be almost similar as 80 to 90%. No?
Okay.
It might vary from person to person. But actually one of the things we need to know is that ekta vaccine be 100% effective no hai. Na? That means not only COVID vaccine, any vaccine for that matter. No vaccine is 100% effective because bokanla body do na respond korea da alag ase na. So hepatitis B vaccine hole bi kunba manu to energy koi de na respond na kore. Tala memory cells kan iman balbra respond na kore. To ito karte maybe supposing one vaccine te kam korene kole to they might try another vaccine. It's a different style of stimulating the memory cells na, the T cells and all. It will stimulate korea to alag technique ase. So if one vaccine doesn't work, maybe they would try another na.
Sir, so mo ani ajikali cases kanini bishi dikhi pai se ke vaccine duita dose la pichre manu aro covid lagya han inia cases can be report ho ase to is it because of the ineffectiveness of the vaccine na idu kiniga ki garne iniga hoya se.
So most of the vaccines etia ulado na they say one is it can protect from infection, secondly it prevents serious infection.
Okay.
Na so infection hoile bhi serious na hoy na. So mola hospital te August 2020 para etia tak 160 deaths takishe na. So 160 deaths te only 2 deaths were after people had been vaccinated.
Okay.
Na khali Twitter dusra kan to sob bhi vaccine loi nai na. Mokan la staff bhi admit thakishe na aru sob manu staff admit korea kan to sob bhi vaccinate loi nai na. Kali I think maybe one. Okay. Now it will be very mild na. Or they didn't take the full dose na. Moi mala sati khan logote kotha koa do say mission hospital now all over the country sob manu report kori ase vaccinate korea staff khan to kun bhi admit thakya nai aru moria khan to sob bhi vaccinate na loa khane ase na. CMC Vellore te around 9,000 to 10,000 employees ase na aru almost everybody nishna vaccinate hoise na. I think 1 or 2 people died na.
Okay.
But those were not vaccinated no, or and they had other very serious other problems no. So we cannot say it was because of COVID or not.
Okay.
But it I mean sure as that vaccination prevents dying and prevents serious infection. It may not entirely prevent infection, but it definitely prevents mortality and serious infection.
Okay.
ICU admission kan.
So I mean you might any vaccine do logi na bhi apni any infect to hui jao pare holi the bimari do any for example mild symptoms kan hi hui jao pare vaccine lo bishi serious na hoigina. So inya ho na sir.
Yeah.
Okay sir
but it will definitely prevent means supposing 10 jon 100 manu ase vaccinate no hoa aro 100 manu vaccinate hoa to definitely vaccinate hoa kan to infection bishi komte hobo as compared to the other 100 which are not vaccinated.
Okay.
So it does prevent a large amount of transmission. Secondly, it prevents severity and death.
Okay.
Yeah.
So to any admi lai sab to any vaccine do lo le kiman important ase.
It's absolutely important no. So WHO etia koa to na vaccine hesitancy vaccine na loa khan na aru boi kha. So it's one of the top 10 global health threats inika likhi kine ase World Health Organization to vaccine hesitancy is extremely dangerous aru bishi manu to fake news para WhatsApp university so jaga para na news loi kene means ekdom confused ase na etu karne vaccine na lo aru kunba matu to religious leaders khan takan ke koi kene na vaccine na lo khan ase. This is the most dangerous thing na, and this is possibly the most important reason that can cause a third wave also na.
Yes sir. To sir ni apni hala hospital de wite da kiman manu nishna vaccinate kuri na ase ko data sna nai.
Yeah, so I think around 50 nishna staff to ita bhi loi nai.
Okay.
Ita bhi convince hoi nai na.
Okay, so
moi kotha koi kene na explain korishe everything hole bhi already news kan bishi na fake news bad signs etu kan sob listen kore kine or religious reasons etu sob loi kine eta to kumba to loi nai na aru etu to difficult ase explain kore bole
convince related. So ini mohan ini sai shugule mohan ini mohan laga Nagaland government bi itu vaccine laga opore manuan fear thaya do itu power address create na nai education kan kilan krole.
Government is trying its best na, but there are certain things means WhatsApp news kan to bishi powerful ase do na aru genuine news para to fake news e bishi they are more creative no, and they know how to do things in such a way bishi digdar ase to means fight kore bole. So I think government is doing whatever they can na sob try kore ase but yeah, there's a limit na takan ki kuro pare
bishi do corona paro da dero certainly amni huni thagya lishna ni vaccine no de associated myths kando ki ase any if you know some any ajekal
yeah the major myths no one is infertility na maiki khan etu vaccine loile to etu pregnant na hobo na. So that is absolutely false. Actually, you can look. So, moike listen na kore kine na. Best thing is to go to the CDC, Center for Disease Control website.
Okay.
That is Sailobi, na hole WHO website. Na hole just Google top 10 universities in the world. Harvard, Hopkins, Mayo Clinic, na. So te takan la vaccine la upar de kaba likhi kine thakibo. Na. So it's better not to listen to just news from WhatsApp and all, na. So myths to bishi ase. The main one is infertility, na. To taken kwato vaccine de ki olai, na. Vaccine laga substance ekta, aru itu worm te, itu same same protein, same antigen ase. To white blood cell to jai kene vaccine te attack korile to worm te bhi attack kuro because similar ase. To itu para infertile hoi jabo. Itu etia proven nai. Aro bishi manu vaccination kore kene bhi pregnant hoise. Na. So that way that is a myth. No, that is absolutely false. Second to microchip dali na. Dalile microchip na. Ale microchip to it is like science fiction na. Amni Hollywood movie bishi dikhele to ito bhi believe kuro paribo na. Hole bhi mokan iman advanced to hoy na. I think we are still very very primitive in that sense, no. To iman tak to advanced kun bhi hoy na na. That is just science fiction nishna ase na. Thought to magnetic hoy jay na. To ito bhi that's also a myth. It's absolutely false, na. So there are several myths which are there.
The most popular one in our city will be 666 last time.
666. Aru ito to Bible te purile to kutte bhi likhya na inika ase koi gine na. To kunba manu tiny jor banaishe to na. So that is absolutely Bible na jane kan to inika kobo. Na Bible pura kan to it's very easy to know that 666 can never come through a vaccine. Na.
Yes, sir. COVID लगाओ पड़े, I mean vaccine लगाओ पड़े myths खान लगा रो, सर ये हो दिलू मंजाओ सर अलग myths कम भी की ऐसे?
एक ता तो ये तो vaccine, especially RNA vaccine ना, मोखन ला DNA change करे दिवो, तो मोखन अलग हो जाबो, ना वाले से after 3 years मुरे जाबो इनका ना, तो इनका भी ऐसे means ताकन myth भी ऐसे, तो actually supposing this is the cell ना, and this is the nucleus, cell nucleus ना. तो mRNA वैक्सीन आहा तो सेल लगा अंदर ते जावो होले भी ये तो DNA न्यूक्लियस ते ना जाए दे ना. तो न्यूक्लियस लगा अंदर ते जाए तो न्यूक्लियस के means affect करे वो पारे होले mRNA वैक्सीन तो न्यूक्लियस affect ना करे. So it just stimulates the cell to produce. No, it's bypassing some of the steps to elicit the antibody. It's a fast track, na. Fast track way of improving the stimulating the antibodies or the T cells.
तो अरो मोहनी ने जो भी जानुले मुंजा से मोहनी दिया इंडिया ने खबर लपाला सब तो नहीं होनी थके कि इंडिया लगा वैक्सीन लो ट्रायल ले भी जाना है निगा कोई थके. So how far is it true? Are you लगा पड़ी कि वो को पाए वो अपनी भी?
No, all the vaccines have gone through clinical trials. There's no single vaccine which has not undergone a clinical trial. No. So supposing let's say how does vaccine nohele medicine kinika introduce kore na market te. So first to pre-clinical trial. Na pre-trial agete to supposing dawa nohele vaccine to itu rats kan nohele monkey kan te dali kina animal studies koi de na tate dali kine first check koribo humans te dali agete to eto de kine supposing cancer olabo na olabo side effect kine ka ase tala effectiveness kine ka ase to sob check kore supposing eto bishi eto sob dekhe kine confidence hoile to next to phase 1 trial koi na to phase 1 trial to mainly safety aro dosing range kan itu kan dekhe na so itu to they'll take just volunteers say 5-10 people na healthy volunteers te dali kine very controlled conditions te check koribo na any side effect safety kan check koribo na aro tala itu dalile to talaga blood te kiman deri uthe kiman deri komti hoi jay itu kan check koribo that's called phase 1 trial then supposing satisfied hoile to phase 2 trial jabo so phase 2 trial it's the same as phase 1 but slightly larger numbers say about 20 to 100 inika manu ke check koribo na aro it be safety aro efficacy alop check koribo phase 3 trial to bishi dangor say about 300 400 volunteers on one side on another side na say testing group or control group duita compare koribo na so it is the phase 3 trial ase it's a very large number it can be like 1000 10000 inika bhi 30000 inika bhi hobo pare na or phase 3 trial check kore ke it's like it's efficacy koi de na actually kaam kore na kore safety kan already dikhishe safety bhi dikhibo hole bhi mainly looking at efficacy kaam kore asna nahi itu check koribo aro phase 3 trial cross hole to phase 4 to post marketing surveillance na so already marketed di dishe aro etia bhi observe kori thakibo so etia vaccine dia time te mokan covid te takan data sob collect kore do na so takan itu bhi follow up kore kine say after 1 year 2 years kineka hoise to be check koribo so it's like the phase 4 na so India te Covishield already Oxford te taken bishi phase 3 trials so pura complete khoi ki nahi India te pathaise to na aur Covaxin to phase 3 trial khatam ho age te release koribole try korise ole protest bishi thaise etu karne taken olop slow thaise na but etia to sob manu bi sob trial bi it will pass hoise na so I think all the vaccines are now past those trials no and ekta vaccine bhi nai phase clinical trial pass na hoa kane bole bhi America hoile to FDA koi na Food and Drug Administration etu to every phase te na before every phase FDA laga approval lobo lagibo no hoile to na dibo na aro emergency use authorization koi na EUA to manu ko bishi manu to etu the emergency ne any emergency ra para ini release kori deshe it's not good enough ineka koi but emergency use authorization does not mean etu kan bypass korishe it's not like that no phase 1 to 3 to pura process to pura follow korishe it's just that the licensing na supposing my ekta application likhishe na ekta clerk logote jaise etu committee follow up koribo na committee decide koribo so those things are done a little faster
procedure
the procedure that they removed all the red tapes so it's not that they bypassed anything it's just that they reduced all the formalities which are necessary but it takes time no so instead of by post they send it by email but otherwise the process is very pakka
certainly mon ini sai shugule vaccine no koi thage nishna alak alak ase do vaccine alak alak duita lobole safe ase na nai etia to alag vaccine to dia nai to na according to the government also if you give one vaccine you'll use the same vaccine for the second dose
because the method is different no so the Covishield vaccine though it's a vector borne vaccine na
yes sir
aro Covaxin to inactivated or life attenuated vaccine ase na to it's different the style of action is different so etu karde supposing etu Covishield kaam kore nai kole to maybe they will try the Covaxin na but it's too early etya kaam korise kore nai it's too early to say right now no
sir to apni lagai sab tv ini kundu vaccine ni bal hobo nishna ini mo na
moi to Covishield loise na mola sati kandu ko nokuma manu to Covaxin bi loise though both seem to be effective.
Okay.
So currently we cannot say this is more superior than the other one, no?
Acha.
mRNA vaccine kan to digdar ase because etu transportation koribole bishi digdar ase na -70 te rakhibo lage tu kan to India te to digdar ase inika introduce koribole na.
Acha. So tuni aro mon ini sari dagi shigule ni mon laga health workers ka noile ni government bi do you think that mass media do power use crazy do manuhan ge vaccine laga educate kurde amila opodi do ki bhavna
I think used to Korea ase but maybe not sufficient, no? We can definitely make better use of it, no? And
like
anti-vaxxers are much I'm not an expert on that, no? On how to use mass media.
Okay.
You all might be better than, you know.
Yes,
I mean, those people who study mass media, they'll be much better than that.
Okay,
yeah. I'm not very creative, so
okay, sir,
yeah,
no problem.
I'm not good at it.
So
I can just write PowerPoint, no? That's the best I can do. Yeah.
So tuni mon ajikali ni jai thake do government employees kan ye mandatory vaccination kya kan bi man issue lagi na se tya doro do you think do apni la isabti do ki apni la ki view ase do la upor de
So government order pass kora to na.
Yes sir.
It hasn't said mandatory vaccination, na? Means by force emergency time te you know Indira Gandhi to pura manu ke na maiki kan ke pura sterilize koriche to the by force government to etia by force ekta bi kora nai ekjon ke dure ke ne vaccination ineka to ekjon bi ineka kore nai ineka korishe koile to that's abuse of human rights.
Yes.
No ekjon ke dure ke ne test koribo নহলে vaccinate koribo etu to etia tak kun bi kora nai na. So if inika korishe kole to that is against human rights. So for example Jehovah's Witnesses na Jehovah's Witness kunba cult thake na, so etu kan to blood transfusion dibo na pare, they don't take blood transfusion. Supposing tai murile bi na lobo ineka koi na, so moi dishe kole to I'm abusing his human rights. Tai karne bal ase jane kole bi I cannot do it because it's abusing his rights. But so far I don't think the government has abused human rights at all, no? Okay. It knows that vaccination will really benefit the population. Ito karne you know basic way ase na, you must do it ko ase. But I don't think there's a single report right now ekjon ke by force loi ja kine, so I don't think itya tak to violation kora nai, no?
So ini mohani ni kui nai thake nishna manuan kui ke vaccination is a choice kui do apni
Yes, it's definitely a choice.
Okay.
You know, but we would definitely try to tell people to vaccinate because we know it's good for them, no?
Yes, sir.
And the data is very clear, no? It's proven without doubt that vaccination saves lives, no?
So tuni coming to an end of this discussion we do mun jaw ita discuss kurina ai thage nishna vaccine do lole reluctant manu bi bisha ase mohan bi ni bahar jana reports kan thage tam dei thokan ini manual views kan bi ni huni thage to apni bi du laga pore manuan ge as a health worker kiba kole mun jaw sir.
Yeah, I think see vaccination is a choice. Nobody can, and in a democracy ta no kun bi apni ke force koribo na paribo na. Only be one thing we are sure is vaccinate na korea khan e bishi muri ase na, we can tell you for sure na, because mokan la hospital te bi 160 manu moria khan do khali dui jone vaccine na korea la ase na, aru etu bi bishi dusra serious bimari bi thaise sob manu moria khan to all those vaccine na korea khan is, so it's fairly clear to us that vaccination saves lives na. So that is the thing which we will have to tell people. Secondly, apni kot para apni la news pai na, that's very important na. WhatsApp para pai ase na apni la nijor la reading para ase or kotte reading kore ase na. So reading korile to reliable news te reliable site te jabi na, CDC Center for Disease Control na, or WHO or Johns Hopkins na, or Mayo Clinic or one of these reliable sites te jabi na. ICMR is also reasonably good now na, and the Nagaland government be ICMR pare mainly information kan loi na. So I think these are so far quite reliable sites na. Aru taikan to all these sites and look at scientific studies, not daily news studies, not newspaper information likhala na. So those may not be done by professionals. So you look at the studies for yourself na. Good scientific studies, not useless journals na. So you look at very good index studies, index journal studies, and then make your own decision, not based on somebody who's just send some WhatsApp message na. Because those are very creative. Takan bishi paka se na, or bishi manu ke convince kore. So I think WHO they have released something called infodemic, information epidemic. So it's WHO website e kinika infodemic address koribo, kinika fake news address koribo, sob likhi kene ase. There's actually a manual on how to read and understand and relate with infodemic na. So any news ahile first to kitya ulaise to check koribo lage na. Was it 1 month again na 1 year ago to release korise? You need to check that. Secondly, you need to check what is the source na. Kun to group kore ase and study that group na. Khali taiki koise phat ine loilese kole to then you're not using your brains na. So read the source for yourself. Don't be a fool na.
Yes sir. True. तो আজি लगा मुहा लगा तो डिस्कशन करने मानी हो. Thank you so much sir. अपनी मन busy था कि लिए मुहंगे मन time दिखे ना मन देरी खोता कोले पार्शलो. Thank you so much sir.
Thank you.
मुहा इच्छा से कि हमें लगा viewers कम भी आज लगा discussion बरा vaccine लगा ऊपर doubts कान था क्या कान दो clear हो गया ना था कि वो और अलग पे ना जाने लगा बिशी जानी ना था कि वो कोई कि ना विश्वास करिए से तो मुहा नारो इन्हें important और interesting discussion कान every week अपनी कान के Hornbill TV unfiltered ते आनी था कि वो और अलग अलग खबर काने साइट था कि भी Hornbill TV.